welcome everybody to Kano Iwanyayi broadcast. I'm excited to have you here, and we have another ordinary person doing extraordinary work. I've got Dr. Tongai Chitsamatanga of CURE Children's Hospital in Bulawayo. Thank you so much, Doctor, for coming. I do know you're a very busy man, but you afforded us this time because I told all my followers and my listeners that we're going to have you on the program to talk about the extraordinary work that you're doing at CURE Hospital, CURE Children's Hospital in Bulawayo.
Thank you for having me.
Thank you. So, Dr. Chitsamatanga, tell me, I do know that CURE Children's Hospital was opened in 2021. That was during COVID, isn't it?
Yes.
Okay. What a time, really. But I brought you here because I want us to talk about the work that you're doing there, as I said. Go ahead and tell me what the hospital is all about, the kind of people you take care of, your clients and your patients. What does it look like? Give us a framework of what's happening at your hospital.
Thank you once again. So, CURE Children's Hospital, as you rightfully said, was opened in April 2021 by His Excellency President Edith Mnangagwa. So it is a public-private partnership between the Ministry of Health and Child Care and the CURE Children's Hospital. And what we cater for pediatric, orthopedic, and plastic patients. So anyone between the ages of 0 to 18. I think what is a faith-based organization, but of course we don't discriminate against patients of any faith. Mm-hmm. So what we normally see are patients between the ages of 0 to 18 with bone musculoskeletal problems, and also quite recently, as of last month, we've also started seeing plastic surgeon patients. So children that come in with brain contractors, children that come in with hip and palate, and all these children from the different backgrounds are treated for free, so they do not pay anything.
So you provide free service to people. No charge to anybody?
No charge at all. So the services, they include consultations. So initially we see the patients. And then if they need surgery, we plan for surgery. At the orthopedic side, we do investigations, for example, like X-rays, and those are free. And of course, we operate them, and all that is free. And then rehabilitate them if they need rehabilitation, all that is free. And,
yeah. How big is your what's the capacity of the hospital, and how big is your team? Because I don't think you operate alone. How big is that team?
So the hospital, in terms of admissions, we've just recently upgraded to 60 beds. So including inpatients, and we also have a place where the patient is coming in for like therapy, and not coming in for surgery, and they're admitted in what we call a lodge. So the total capacity is about 60. And then the staff, we're about 98 of us. So that includes doctors, that includes the nurses, nurse assistants, and also, the administrative staff, the physiotherapists. Yeah.
Where most of the patients, which part of Zimbabwe do you cover? The whole of Zimbabwe? Do they come from Mashonaland, Nikaland, and Bulawayo?
So we cover the whole of Zimbabwe. We see a significant number coming from Harare, and then of course locals do come in. Yeah, but it's all over. We've seen patients as far as coming from Chirundu, We've seen patients coming as far as Victoria Falls. We've seen patients coming as far as Binga. I've seen some patients coming from Mani areas where I used to work before I specialized in orthopedics. So it's from all over. Nyanga, as far as Nyanga, I see patients.
But then, how do they know? How do they know about this? That there is a special hospital really for treatment of bones, because that's basically what you do. Well, more than bones. But how do they know? Because I would,
So,
if they are out in the rural areas in the village there, and they've got a child with clubfoot, they wouldn't know that there is such a thing, would they?
yeah, so I think we've got patients whom we have helped. I think word of mouth mostly. But of course, for those that have access to social media, we're on social media. And then the different hospitals, because I think, like I said, we are in partnership with the Ministry of Health and Childcare. And so we have doctors, maybe, for example, doctors in Mani referring to us, so they know about us. And then our system is such that we've got a primary healthcare system. This is the system in Zimbabwe health-wide. Primary healthcare system, that's where we have clinics, and then you have the hospitals, rural hospitals, and then you've got the district hospital. So in those stages, once someone is at primary health care level, they are then to the hospital, to the district. At the end of those stages, they also can get to know about us, because some of the patients who we have treated, they are also fed, maybe rehabilitated at the end of those hospitals. So I think they get to see the work that we're doing, and then they get to also refer to us.
How long have you been an orthopedic surgeon yourself? You look quite young, and I'm just thinking how long. When did you graduate, and when did you start practicing?
Okay, so maybe let's go back to how long I've been a doctor. So I've been a doctor since 2004. That's when I graduated from the University of Zimbabwe. And then I did 2 years of internship at Parinyat, then went to Chimanimani at a mission hospital called Mbara Mission Hospital for 6 years, and then came back to Harare to specialize. I did 5 years with a college called Sexa. So this is a borderless, a wallless college, which there are about 14 African countries who are members. And then the hospitals which are accredited to train. But you also have an opportunity to go anywhere within the region. If maybe there's a part in your specialty where you need to maybe more hands-on experience. For example, before I graduated in 2017, I went to Malawi in 2016, and that's where I fell in love with pediatric orthopedics. Then after graduation, 2017, as an orthopedic surgeon, I then did a year. You have to do a year of what's called senior registrar year, where now you're consolidating the skills that you've learned. You're also now being polished to become a specialist or a consultant. So I did for a year at Parinyat. Afterwards, that's when I went to England in 2019 until 2021, where I did more on the pediatric orthopedic side.
Oh, okay. Now, what is CURE? Because I read a little bit about it, and that yours in Bulawayo, there's a teaching hospital.
So no, CURE, like I said, it's a faith-based or Christian hospital that is in partnership. For example, here in Zimbabwe, it's in partnership with the Ministry of Health and Childcare. And we provide free services to children that have both musculoskeletal conditions and also now plastic surgery conditions. Yeah, so it's all about providing equitable care to children with those particular conditions, irrespective of their religion, economic background. Uh, yeah, and
But then I think is it just in Zimbabwe? Because I do believe in Uganda they also have a cure, and I think in Kenya. So is it an international? Are you associated to any international organization?
yes, it's Cure International, and it's based in the United States, but yeah, then runs the different hospitals. There are eight, so there's ourselves, we're the newest. There's Malawi. I think Malawi and Zambia probably those formed around 2003. There's Uganda. There's Kenya. The Philippines. There's Niger. Yeah, and mostly we do pediatric orthopedics. But Uganda also does new surgery for kids, and yeah, and then the plastic surgery service seems to be now coming up in most of the hospitals because we've got it here. In Malawi, it starts. Zambia soon will be joining us.
When I was reading the background to Cure Children's Hospital, oh, can you hear me?
Yes, I can.
Okay, I was echoing. I don't know what was happening there, but I was reading in the a little bit about your hospital, and that you cater for. This is a hospital which is the only pediatric hospital in Zimbabwe, a country of about 16 million people. Are the statistics correct?
I mean, there are other pediatric hospitals. For example, at Salimga, there is a pediatric hospital there. Then it's specialties that differ. So we are probably the only pediatric orthopedic and plastics
Okay.
hospital. Yeah,
Okay,
Zimbabwe.
that I think that's where that I didn't get it right, and I believe 53% become people who come, who have such conditions. 53% become disabled before the age of 20. Is that because of lack of knowledge of what's available when children are born with such condition? Recommendations made that the children go through their to say come to you for surgery, or what's going on there? Why would they wait until they're like 22? Usually they probably just live with it, that this is the situation. Or what does this mean that 53% become disabled before the age of 20?
I think it's a combination of factors. I think also remember we've just been in existence for about 2 years.
Mm-hmm.
Obviously, you look at a population of 16 million and maybe a size of percentage. There are a number of factors. It's also, I mean, you look at even the economic situation can lead families to probably not be able to seek health care early. I mean, it's an expensive process. I mean, it's not like they'll come just for one visit. They'll probably come for more visits. So in this particular scenario where we are not present, the families still need to find a way to the hospital. There are certain things that we cannot probably assist with. I mean, we can't assist all Zimbabweans to come to us. Of course, later on we'll probably do outreach, but still, that's just a drop in the ocean. So I'm sure maybe with time, with our existence, also maybe existence of
Mhm.
the other people that will pass through our hospital and we train them, probably be able to recognize some of these correctable problems. But I mean, it's just part of the process, and I think maybe Zimbabwe in the right direction because
Mhm.
we now have a hospital like ours.
Do you sometimes do you get some some patients who you refer to the other your sister organizations in the region? For instance, maybe Kenya or Tanzania, where you have patients who might need help over there.
Yeah, but, for example, we don't do pediatric spines. Pediatric spines is done in Kenya. Yeah, so there are sometimes, I think I've referred one or two, but of course there are logistical challenges. The caregivers have to get passports,
Mm-hmm.
they have to flights or look for money for flights. And so it's not an easy referral, not like just
Mm-hmm.
referring someone to a hospital which is 100 kilometers away. There's a lot of logistical challenges.
Yeah, because
But
I suppose they might not be able to afford flying
yeah,
there and the
uh,
accommodation while they're there.
yeah,
No, this is very interesting because when I look at the situation, if you go in the rural areas, there are so many people you see with conditions which otherwise can be rectified, can be managed or can be treated, but because of maybe lack of knowledge, and also sometimes people just accept it that Chaita mwana chirema, and so they just stay with it because it's not like sometimes it's not a painful condition, but it's something that can be fixed. But I hope with your existence now and working with other primary caregivers, they are able to tell to educate the people they have in the rural areas that this can be fixed, right?
yeah. No, that's very very true. And I think let's also not underestimate the power of even the public health system, because remember, if you look at HIV and AIDS, HIV/AIDS, TB,
Mm-hmm.
maternal and child health, it really does start at primary health care level. So you find the primary care nurse who is at maybe a clinic in Nyanyadzi, in
Mm-hmm.
Chimanimani. They've got information on things to do with HIV and AIDS. Now they are able to start treatment. And so, for example, these are some of the things that we will probably ride on in
Mm-hmm.
terms of disseminating information, and also in terms of follow up. Because when we treat these patients, they go back to the environment, the same environment. So
Mm-hmm.
sometimes you do good surgery, but then the nutritional issue to wound healing. And therefore, we must coordinate and make sure that when they go back to where they are coming, for example, even social services are involved, ensure that the children whom are also nutritionally covered,
Mm-hmm.
making sure that now that they are able to maybe mobilize, they are going to school. So there are many factors we can
Mm-hmm.
ride.
Which conditions are more common, the ones that you treat more?
I mean, there
Essentially.
is see quite significant clubfoot. Those that have never been treated, or maybe those that have recurred. Um, and yeah, so we see quite significant clubfoot. We're also seeing quite a number of children that have osteogenesis imperfecta.
Which
Sometimes they come
sorry, I missed that. You see a lot of
uh, os-
children.
with osteogenesis imperfecta, so the brittle bone disease.
Mhm.
Yeah, so they come sometimes with deformities, and then they are unable to walk. It's a history that they are always having a fracture at return. Then we also have some that come with nutritional deficiencies, for example, kids, and coming with deformities. There are some coming with deformities after fractures, and some coming with bone infection issues, maybe after a fracture, an open fracture. So we see quite enough.
You do fix not clap knock knees, children with knock knees.
Yeah, we see them. Yeah, and we assist them.
Is what causes that though?
There's a variety of things. It could be nutritional. So we do see some kids are coming with rickets and they come in with no kidneys.
Mm-hmm.
And there are some who cause you don't know, but they come in with painful knees. They're having difficulties walking because the knees are hitting against each other. Yeah. So, yeah, in some cases you don't know the cause, but of
Mm-hmm.
course you can just make sure that you treat and make mechanical alignment good.
Dr. Chitsamatanga, what is it that drew you towards this orthopedic surgeon? You're a doctor, and then what really got you into it that you felt this is my calling?
So I think it was more of just recognizing the need at the time when I was in Chimani. I would see the patients coming after road traffic accidents and just splint them and then send to the nearest city, which was Tare. But then Tare didn't have an orthopedic surgeon, so it would be referred to Harare.
Mm-hmm.
Yeah, so I think just that need and realizing this is an area which was not fully serviced.
Yeah, it's definitely not a crowded profession. How many orthopedic surgeons do we have in Zimbabwe? Not necessarily pediatric, but in general, how many do we have? Just wondering.
I think that, but now gets around to around 40. Because what has happened is over the past maybe I could say 10 years,
Mm-hmm.
because of that college I mentioned, the College of Surgeons of Central and Southern Africa.
Mm-hmm.
It has allowed, the expansion of teaching is allowed. Um, Before, if want to do training through an university program, it was just one university which was training, but wasn't orthopedics anyway. You'd find that it could take maybe for two orthopedic surgeons to be trained, it could take my 5 6 years.
Mm-hmm.
But when we trained, we were able to train more fast, and we were able to train directly into orthopedics with the support of various partners, with exposure to different things. Yeah, so that is quite that has helped.
So most of them did. Some of your colleagues that you trained with, are they working at some of the central hospitals or the government hospitals or in some rural
Yes.
hospitals? Yeah.
So I think now we have an orthopedic surgeon in near all the provinces. Um, and this was like before. I mean, before it used to be just Harare and Bulawayo. Now we have an orthopedic surgeon in Mutare, we have an orthopedic surgeon in Chinoi, we have an orthopedic surgeon in Kweru, so covering um, those provinces. So
Do
I
they
think
have
it's a big
do
plus.
they have the equipment to do that in all those kind of like small places like rural areas like Gweru and those hospitals? Do they have adequate equipment
I
to
don't know about adequate, but equipment, yes. And also, what happens is what we've seen is sometimes equipment follows the specialist.
Mhm.
Because once in place, they're able to then say to the administration, either of the hospital, province, or even ministry, say, look, I'm in place. This is what I need. And the ministry has been receptive, and their processes to try and make sure that there's a central ordering of the equipment that I need, and then distribution to the different provinces.
Mhm. Oh, that is really interesting. And I don't know what else can you tell us about the work that you're doing, because this like I call my segment, ordinary people doing extraordinary work that is very much needed by our communities. what else could you tell us about your work?
I think most of the things I've said, but the key issue is just maybe as communities to just help each other identify the kids
Mhm,
who might need the service. And sometimes even if you are not sure, you could just ask even at the nearest health facility to say, look, is this something that could be assisted at cure? And we, like I said, on social media, on Facebook, you can go to the Facebook page and the number is there for one to call and find out. There's a WhatsApp number one
mhm,
can message to just say, look, I've got this child, so maybe to send in a picture
mhm.
with kind of problem, then communicate and say, is this something that we can assist with? Of course, if something we can assist with, we use the booking system. You're given a date to come. You come, the doctor see you, and then plan is made.
Thank you so much. I really I don't know how to emphasize to thank you enough for the work that you're doing, because without your help, without this kind of help, I know you've just been in operation for only past 2 years, but I'm sure a lot of people have come through your hospital so far. I don't know how many would you say estimate how many people have gone through your hospital surgeries, who have had surgeries through this cure.
So in terms of outpatients clinic, I think close to 8,000, and then surgeries maybe about 1,700.
About 8,000 of people who have come through for different for the
Come through
variety.
the come through the clinics to do clinics.
Mm-hmm.
Yeah, so they've come through outpatient. Then surgery is up to 1,700
It's
2 days.
amazing. Only in only 2, is it 2 years now that you guys have
Yeah,
been with? This is amazing. This is amazing. I would like to thank you so much for the work that you're doing, and continue doing the work that you're doing. And for people out there, anybody who knows somebody who might who could use these services, please recommend them. Tell them to go to Cure Hospital, Pediatric Hospital in Bulawayo, and get, as for Dr. Tongai Chitsamatanga and his team, I know you don't work alone. You work as a team, and thank you very much for that work. And this is the kind of thing that we want on Kano Iwanyai broadcast. We try to bring this to people, because there are many, many things that are happening in Zimbabwe that people are not aware of, and we try to bring it to people so they know the work that you're doing. And thank you so much.
thank you. I think the last thing that I would want to encourage, especially Zimbabweans in the diaspora, if you go on to like our website,
Mm-hmm.
you find that there are opportunities where you can donate towards these areas, because definitely they do cost
Yes.
money. But I
Mm-hmm.
think as Zimbabwe we need to take ownership, because imagine the phone call from a relative, say 5 years ago, to say that my child has broken his leg, broken his arm. Um, the $2,000 is needed for them to be operated. Whereas in this particular instance, we're saying we're bridging that gap. But obviously, I mean, if people can donate towards the surgeries, it goes a long way.
Yes.
Also allows us in Zimbabwe to take ownership and say, look, we are helping fund this thing. And it doesn't have to be anything major. It could to say I'm donating £5 a month for the next
Mm-hmm.
12 months. And if
Mm-hmm.
you get 20 of your friends, if you get 100 of your friends,
Mm-hmm.
that's a lot. That's a lot in terms of contribution.
Definitely.
So I'd encourage us to take ownership, and I'd encourage us to have that
Mm-hmm.
mentality and that spirit to say, um, let's make it work.
Thank you. That is so important for people in the diaspora. You heard what the doctor said, and what is £5 a week, a month, even, or us in Canada or United States. There are so many people in the diaspora. We really can make this thing work even better. It helps other people who might not be your relatives, but somebody could benefit. These guys are doing great job providing such services to people who need it. And the least that we can do in the diaspora is support them. And like you said, take ownership of this. I think we should move away from always give us. If we can do, there's so many people in the diaspora who could help. Thank you so much, Dr. Chitsamatanga.
Thank you for having me.
You're welcome. Everybody who is listening, those who are following us, thank you so much for listening in. And as I brought another ordinary person doing extraordinary work, I will see you later. And next week, we have another person who will be talking to us about the work that they are doing. Thank you so much. From me, Sangwadzi Spiwe, have a great evening in Zimbabwe, great afternoon in Canada and the United States. Thank you.